there are a lot of Democrats who control the Senate that support the bill, and so they would have the ability to kind of hold it back, hamstring it, and President Obama would still have the option of vetoing anything that came before him on repealing the act. As for declaring it unconstitutional, that was a suit brought by Florida on behalf of 26 other states, and there have been 4 similar suits. 2 declared the act unconstitutional. 2 declared it just fine, not invalid. So what I would say there is just kind of watch. The U.S. Supreme Court may eventually have to make the decision on this, but so far it's just kind of a holding pattern. Okay, we've already touched on most of the things in this slide, but what I really want to focus on for you is that class program we talked about, which is the National Long-Term Care Insurance Program that the Act is trying to implement and get moving. The class program would be just like a traditional private long-term care insurance program where you could decide to opt in, your employer could decide to cover you, you could opt out, and it has an estimated average monthly premium of about $123 and then an average daily benefit of about $75 per day with no lifetime benefit limits. That's kind of a neat thing. I know if you've ever purchased private health or long-term care insurance, a lot of plans, the majority, have some sort of benefit cap. And once you hit it, it's kind of too bad for you. If you do that math, the class program would cover you at about $2,100 a month of coverage. Now, most of you probably know that assisted living facilities or nursing homes in Florida can range anywhere from $2,000 to $10,000 a month, depending on where you're at, what services you need. So $2,100 a month may be a big help, may not. It's certainly better than nothing, but it's also probably not enough to cover you fully. And just like private long-term care insurance plans, there are vesting requirements. You have to pay into the plan, pay premiums for 5 years before you can receive benefits. You have to work for 3 of those 5 years. And you have level of care and placement requirements just like you would have to receive benefits from any other long-term care insurance program. And additionally, you have to continue paying the premiums to continue receiving the benefits. So that may not work for everybody, but it is a nice option to have in addition to private long-term care insurance. Moving into 2012 and 2013, what's projected with the Act is some additional changes to those Medicare Advantage plans to, again, try to save some money so we can spend it elsewhere. The Medicare Independence at Home program, which is similar to that Medicaid Community First option that we talked about, trying to get some in-home attendant services to divert people from skilled nursing care for as long as we can. And the reduced payments for hospital readmissions under Medicare. The goal here is to try to improve care for people by not rewarding hospitals for having to readmit based on issues that could have been fixed the first time around, infections, that kind of thing. So the Act is trying to put certain incentives like this in to try to improve the quality of care for people who are receiving benefits under Medicare and Medicaid. In addition to getting them more care, we want better care. On this slide for 2014 and beyond, there's 2 things I really want to pay attention to. One, I've got some stars by it even, is this presumptive Medicaid eligibility. What we're talking about here is that the Act is going to try to phase in the ability for certain providers, administrators, caregivers, caseworkers to make a quick snap judgment on whether or not someone would be eligible for Medicaid to try to get them the benefits faster, rather than having to go through the normal channels. That sounds excellent, and hopefully it will work out, but there's probably going to be some administrative issues. Who's going to be making the assessment? What happens if the presumptive eligibility assessment was not totally right? Who's going to be liable for any payments that are paid out that need to come back? I know some people have probably heard if you were receiving VA benefits, for example, and they had to stop for some reason, Sometimes there's a bureaucratic slowdown or paperwork problems, and you continue to receive the benefit for a couple months. Well, then the VA wants that money back. And who are they coming to get the money back? You. So there might be some administrative issues with this, but on the face, there's definitely a good reason for it. The second thing is this reduction in Medicare and Medicaid DSH, or disproportionate share hospital payments. What this refers to is hospitals that routinely see a disproportionately larger number of low-income patients. The Act wants to kind of spread some of that wealth around. One, to try to get better providers to those facilities. A lot of times they're rural facilities. We want to get better doctors, better nurses out there to help take care of those people, but also to try to get some of the money flowing around to some of these hospitals because they bear a bigger burden of lower income people. Okay. Most of this has been an overview, and a lot of it's very complicated, and we understand that. And also we haven't talked about a lot of the other parts of the Act, the uninsured coverage, mandated coverage. So if you guys have more questions, one, you can certainly ask them here. Two, you can always email us. The email address should be in there. It's info@etelf.com. Also, I've got a couple websites here for you that would be helpful. As you can see, the first, second, and fourth are all government websites. The first two are the ones that were set up to directly answer some questions about the Healthcare Reform Act. The third one here is the Department of Children and Families, which is the organization in Florida that administers Medicaid and all Medicaid programs. So that's a good place to start too if you have some questions. Okay. There's a lot of really good things in this Act that will hopefully help a large number of seniors, caregivers, and people under 65 as well. But what you really need to understand is that even if every single thing that this Act promises comes true, and it withstands all constitutional scrutiny and everything, the Act alone is not going to be enough. I mean, we talked about the issue with sustaining a long-term care policy and how $2,100 a month probably isn't going to cover you. Healthcare costs are probably going to continue to rise as well as we live longer, get sicker, all that stuff. So there are other things that you can do and should do to prepare yourself. Mr. Fowler is going to talk to you about what you can do and what options you have. Before he does that, let's take a little break, maybe 10 minutes or so, get a cookie, water, and I'll see you guys in a second.
We like